My name is Nathan Conover over here at Nexus Youth and Family Services, and today I want to have a little discussion about mental health, just a little mental health one-on-one, what everyone should know about mental health, and also breaking the stigma, because we know that there are plenty of people out there who maybe don't know what mental health is, or even maybe they have this idea about mental health that is kind of negative. So today we're just going to kind of unpack that and have a little talk about it. So before we talk about the possible stigma or bias that a person might have with mental health, first we have to figure out what even is mental health. How do we define that? A good working definition for us for today is an individual's emotional, psychological, and social well-being. It affects how we think, feel, and act by helping us determine how to handle stress, relate to others, and make choices. Okay, so that's kind of the framework that we'll use in order to think about mental health for the purposes of our discussion today. Our mental health undergoes different developmental stages throughout life, meaning that our emotional or psychological or social well-being or our understanding of those things can change from the time that we are, say, 7 years old to the time that we're 50 years old. It can change all the way throughout life based on a few key factors. Some of these factors that play key roles within our mental health are biological, meaning our genes or our brain chemistry, just the way that we're wired. Our life experiences, meaning trauma or abuse or plenty of other environmental factors, and family history of mental illnesses. Have our parents suffered through this? Have our grandparents or our great-grandparents? Basically, these key factors boil down to the nature versus nurture debate, which really the answer generally is it's both. Both of these things play a big role. All right, so now that we have defined mental health, what we can now look at is kind of just what is mental health and what isn't mental health, because there are some myths out there or some misunderstood preconceived notions about what mental health is. So here over on the left of the screen, you'll see that there's a little breakdown of what mental health is and what it is not. Okay, so what is mental health? It is important. Our minds are important, taking care of them. It's something that everyone has. If you have a body, you have a mind, and taking care of that, like I said, it's important. It's intrinsically linked to physical health. Okay, our body and our mind are connected. Mental health is on a continuum. It's not just good or it's not just bad. There's a lot of space in between, and often it can be both at the same time. Mental health is worth making time for. It's part of being human. It's something we need to look after. It's both positive and negative, often at the same time. It's changeable. It's not fixed. It is complex. It can be pretty complicated, and it's very real. Okay, so what mental health isn't? So some of these are kind of just the myths that we're trying to bust. Mental health isn't a sign of weakness. This is a pretty common one. People think, oh, if I go to counseling, I must be crazy. But really, going to counseling is for everybody. I know plenty of healthy, really great people who go to counseling just because it's helpful. Mental health isn't shameful, nothing to be ashamed of. Mental health isn't just all in your mind, okay? Like we said before, mental health is often affected by your brain chemistry, by the way you're wired. Mental health isn't always something negative. Mental health isn't something you decide to have. Mental health isn't something to think about only when it feels broken. Okay, it's good to think about mental health even when you're feeling good, feeling healthy, feeling well adjusted. Mental health isn't an interchangeable term with mental illness, okay? And we're going to get into that in about a little minute. Mental health isn't feeling good all the time, right? Because that's not possible. As people, we go through mood swings. Mental health isn't something you can snap out of, okay? Mental health isn't fixed, meaning you can change. Mental health isn't fake news. It's real, okay? And we're only discovering that more and more and more. So back to mental illnesses and the difference that has between mental health. Okay, so there's all sorts of types of mental illnesses, and I'll give you a little breakdown kind of just the major categories. The first category would be anxiety disorders, where people feel excessive fear and dread. An example of this would be a phobia. Okay, another type would be a mood disorder, which means that you have persistent swings in mood or persistent feelings that interfere with daily life. Okay, so think about, general depression or bipolar disorder, things like that. There's psychotic disorders, which means that your thinking is very disordered. It could mean that you're kind of detached from reality. So an example of this would be schizophrenia. Eating disorders, which means that you have a very extreme emotional attitude toward food. The examples would be bulimia or anorexia. Impulse disorders, which means that you're unable to resist your urges, such as kleptomania, pyromania, gambling. Okay, and then personality disorders, which means that you have extreme inflexible personality traits. This would be antisocial disorder, where there's just a complete lack of empathy, or obsessive compulsive disorder. And then we have post-traumatic stress. This is persistent, frightening memories leading to emotional numbness. And as the title of the disorder would suggest, it is always a result of traumatic experiences. Now we can take a look at some of the common red flags. A couple of slides ago, I talked about how mental health is on a continuum. It's not entirely good, it's not entirely bad, it's often both positive and negative. And these are some of the things to look for to see if there's improvements that you could make with your mental health. So these are some of the red flags, meaning these are some of the things where if you are experiencing these things, it could be time to go to counseling, or it could be time to try to work on these things to try to improve your mental health. Okay, so the first one is unhealthy eating habits, like I was talking about with bulimia or anorexia, binge eating or not eating enough. That would be one red flag. Sleeping habits, if you're experiencing insomnia or if you are sleeping too much, this could be a sign that your mental health isn't quite where it should be. Low or no energy, feeling numb, meaning that you just have a hard time feeling anything, feeling either joy or pain. Physical aches and pains can sometimes be a sign that mental health is at the root of it. Feeling helpless, feeling hopeless. Smoking, drinking, or using drugs more than usual could be a sign that you are trying to numb out, or you're trying to medicate and try to deal with pain in a way that is not helpful. Feeling confused, forgetful, on edge, angry, or upset. And these things are not uncommon to the human experiences, and in certain scenarios it's very reasonable to feel confused or feel angry or upset. But if it's happening constantly and if it's happening without cause, that you might want to take a look at what's going on. Feeling worried or scared. Feeling yelling, fighting with family and or friends, taking it out on them even if they're not necessarily doing anything wrong. Severe mood swings, meaning really high highs to really low lows. Persistent thoughts and memories that you can't control. We call these intrusive thoughts or flashbacks even sometimes in the case of PTSD. Hearing voices or believing things that are not true. This can take the form of hallucinations sometimes. Thinking of harming yourself or others. This would be especially important to reach out to people so that they can create a safety plan for you. And then an inability to perform daily tasks. All of these things could be red flags. Some of them, they will happen naturally based on the situation, but some of them, if it's happening too often, or if it's happening without just cause, then it may be time to think about where your mental health is at. Now that we have looked at some of the red flags to look for regarding our mental health, it's also important to talk about why we should strive for positive mental health. Firstly, we can operate at our full potential. Second, we can cope in healthy ways to stressors of life instead of coping in unhealthy ways that will result in circumstances that we regret. We'll be able to work productively, and we'll be able to have meaningful relationships within family, friends, and the community, which ultimately is one of the best ones that we can hope for. Now, how can we do this? How can we get to this place of having positive mental health? There's a few ways. Firstly, you can get professional help, going to a counselor, therapist, or a registered clinician to be able to talk to someone who is there. It's their job to be able to be there for you. Staying connected to family, friends, and community. Keeping a positive outlook. Having an attitude of gratitude. Physical activity has been shown to be able to help increase positive mental health. Helping others can change your perspective for the better. Getting a good night's sleep, never underestimate a good night's sleep, and then developing healthy skills. Now let's talk about self-care. This is a term that is really coming to light much more in the public eye because we're realizing how important it is for positive mental health. So if you look at the screen, you will see mental health self-care wheel. And because there's all sorts of different facets and areas of life that you will need to be intentional with your self-care in order to have a well-rounded positive mental health. Okay, so there's physical, psychological, emotional, spiritual, personal, and professional. And here are some ways to improve your mental health in all of these areas. First one is regular medical care. Okay, make sure that you're going to a doctor, getting your checkups. This can be difficult sometimes during this day and age when health insurance is sometimes hard to afford or inaccessible, but as much as you can or as much as you have the ability, medical care is important. Eating healthy, something that we have a little bit more control over, even though it can be very difficult to avoid the pizza or avoid the French fries. Eating healthy with everything in moderation can be a really quick way to increase our positive mental health. Same with exercise. This doesn't mean we have to work out for 3 hours at the gym every day. It could just be, going for a walk and getting your steps in every day, or going for a run, or doing a little workout here and there, at least getting some exercise. Setting boundaries. It's okay to say no. I think especially in America, in our country, we are used to running at 100 miles per hour all the time and always saying yes to everything and not taking vacations, and the list goes on and on. But setting boundaries in order to take care of ourselves is a huge one. Eliminating bad habits. Asking for help. This one is huge. We don't have to go at it alone. Do more of what makes you happy. Make sure that you are doing something that brings you joy. I think a lot of the time we take care of other people before we take care of ourselves, and that is often a good thing, but also need to make sure that we do at least 1 or 2 things a day that make us happy as a person. Set goals, just so that we know where we're going. Explore a new hobby, something you're interested in. Make sure that you have something just for yourself. Spend time in nature. It's always good to get outdoors and breathe in some fresh air. not just be inside with fluorescent lights all the time. Meditate. This can be a little bit intimidating if you're not entirely sure what meditation is. And if you don't, I would encourage you to look it up and research it a little bit. Some normal Google search will give you everything you need to know about meditation, but the gist is really just about being aware of your thoughts, your feelings, and your body. And it could be really helpful to just be still, right? And then communicating your needs. No one can read your mind, so we got to be able to vocalize what it is that we need from others so that we can improve our mental health. And the beautiful thing about all of this and this entire discussion is that you're not alone in this. Mental health matters for everyone. 1 in 5 American adults will have a diagnosable mental health condition in any given year. And 50% of Americans will meet the criteria for a diagnosable mental health condition sometime in their life. And half of those people will develop conditions by the age of 14. Okay, so to say that you are not alone in whatever you are struggling with is absolutely an understatement. So it's important to gain awareness and get the facts. Have a conversation with somebody about what you are going through. And here is how to have a conversation about mental health, because talking about mental health is an important part of being able to break that stigma. So here's what you can do and what you should not do when you have a conversation about mental health. You should listen without judgment. That's important. Ask, how can I help? Let them know that you care. That's huge. Validate their feelings. That's a big one. Tell them you want to hear. They're not a burden. Listen with the intention to understand and not to fix. I'm guilty of this one. Ask when you have time to listen. All right, not if you're just in passing. Ask how they're doing if you actually have time to sit with them and talk about it. Be patient, because sometimes it takes a while. Keep in touch, even if you get no response, just so that they don't feel alone. And empathize. Try to put yourself in their position and see things through their eyes. Now, here are some things you do not want to do. You do not want to interrupt or speak over. It's not good. You don't want to tell them how they should feel. You don't want to jump in with solutions or belittle their feelings or even pressure them to speak. You don't want to tell them the illness or feelings they have are a choice, because often it's not. You don't want to say, you just need to ... because a lot of the time it's not a simple straight line. You don't want to diagnose them if you're not qualified. All right, we don't need to pathologize. You don't want to leave them out, and you don't want to be scared to speak about feelings. And you don't want to be critical or blame, especially because often it isn't their fault. And now we need to address a really big topic, suicide. Suicide is one of the most devastating things that anyone can experience, losing a loved one. And it can be prevented, is the good news. But here's a little bit about suicide. There's some very important risk factors that influence whether or not a person chooses to die by suicide. Previous suicide attempts would be a pretty obvious one. Relationship problems can sometimes be a precursor. Access to harmful means, such as weapons or things of that nature. Recent death of a family member or a close friend. History of a mental health condition. Ongoing exposure to bullying is a really big one for kids and teens. Losing a friend or family member to suicide. Sometimes these things can start to affect other people. And physical disability or illness. And sometimes you can't even see the pain. Unfortunately, the warning signs of suicidal thoughts are not always as simple as the chart on the left. So here are some other things that you can look for, some more subtle things to be aware of, to be able to clue into. If they're putting their affairs in order, meaning it seems like they're starting to put things, or arrange things in order to kind of move on, or they're trying to tie up loose ends, that kind of thing. Withdrawal, if they're isolating themselves. Increased drug or alcohol use, more so if they do this normally, more so than they normally do. Giving away possessions could be a sign. Anger, no sense of purpose. Sudden mood changes, mood swings. Feeling hopeless, helpless, or desperate. Changes in sleep, anxiety, or agitation. Reckless behavior. And then, of course, talking about wanting to die by suicide. So like I said, suicide can be prevented, and you can help save a life by recognizing all these signs, but then also by starting the conversation with that person. Hey, I noticed this. I just want to make sure that you're okay. And here we have some very practical ways that we can help to destigmatize mental health, because your words matter. Okay, so we've got a list on the left of the don'ts and then a list on the right of the do's. Okay, so don't say someone is crazy. That does not help. Rather, you can say mentally ill. Okay, and don't use mental illnesses in colloquial speech, as in he's so OCD, because odds are they might not be. Rather, use mental illness terms only when intending to discuss diagnosed mental illness. So if you know that this person has been diagnosed with OCD, then, between the two of you, that's okay. But if not, let's not pathologize. Don't say, I'm so depressed, or I had a panic attack, if you're not clinically depressed, or if you didn't have the true definition of a panic attack. Rather, you can say that you were sad or that you were nervous instead of actual mental illnesses or symptoms. Don't use terminology for death casually, as in I'm going to kill myself or I'm going to kill you. Rather, only use this if you are truly struggling, okay? Avoid using suicide as your normal day-to-day language. Don't undermine or put down mental illness treatment, such as therapy, counseling, or coping skills. Rather, regard mental health as positive and useful. And then lastly, don't negatively refer to psychological medications. You should understand that some psychological medications are beneficial, and for some people they're actually necessary. Unfortunately, the stigma against mental health has a lot of different types and manifests in a lot of different areas of life. There are 7 types here that we'll go over. The first type is just the public stigma. This happens when the public endorses negative stereotypes and prejudices, and this results in discrimination against people with mental health conditions. The second type is a self-stigma, which is where a person with a mental illness internalizes that public stigma and thinks, oh, well, I must be crazy or I must be bad. Type 3 is the perceived stigma, which is the belief that others have negative beliefs about people of mental illness. The fourth is label avoidance, and this is when a person chooses not to seek mental health treatment so that they can avoid being labeled as this thing or that thing. Label avoidance is one of the most harmful forms of stigma. Type 5 is stigma by association, which occurs when the effects of stigma are extended to someone linked to a person with mental health difficulties. This type of stigma is also known as courtesy stigma and associative stigma. Type 6 is structural stigma, so institutional policies or other societal structures that result in decreased opportunities for people with mental illness. That's considered structural. And then 7 is health practitioner stigma. And this takes place anytime a health professional allows stereotypes and prejudices about mental illness to negatively affect a patient's care. How can you get help for yourself or a loved one? Okay, so it's important to never self-diagnose, first of all. Don't go on WebMD or Mayo Clinic or whatever website it is that comes up. Uh, the reality is that there are professionals who have a lot of education and training that are trained to be able to provide diagnosis if need be. You don't need to do that yourself because it'll probably be wrong. Okay, your insurance company can give you a list of providers, both medical and therapeutic. Okay, they can give you referrals. A doctor can help you rule out physical conditions because sometimes physical conditions affect the mind. A therapist can help you develop stronger coping skills. In other words, managing stressors or some of the other difficulties that you're facing. A therapist or doctor can refer you to a psychiatrist in case you need medication. And if you are watching this video, you are probably in our area in Amador County, so I also want to make sure that I provide you with some community, some local resources, so that you can stand up against stigma. No health without mental health. We've got the National Suicide Prevention Lifeline, okay, just in case you are suicidal and you just need someone to talk to and it's an emergency. The number is right there, and they have a text line as well. And then they also have this if you are a Spanish speaker. There's also Calaveras County Local Crisis Line, and then the number is right there, as well as the Amador County Local Crisis Line. And then we also have the suicidepreventionlifeline.org, which is a website, and then samhsa.gov. All of these are resources that anyone with a phone or access to the internet would be able to access. Thank you all for watching. I hope that you guys subscribe to our YouTube channel. And our address is right here, Nexus Youth and Family Services. In case you guys ever want to come and get local resources, we would love to be able to help you, and we are here for you. Thank you very much.